If you are a woman over 40 and you are dealing with symptoms that feel a lot like low progesterone, maybe your sleep is just getting really poor lately, your cycles are getting shorter, you're spotting between your periods and things like that. Before you jump to just buying some yam cream on Amazon, you got to stop and watch this episode. Dr. Jake Schmutz from Integrative Medica and I are going to be talking about what the symptoms are for low progesterone and actually what are the causes. And oftentimes it's not just what you think. There are numerous possible causes for these symptoms. And he's going to be talking about what we can do at home and what we can do at the doctors to be able to start feeling better and no longer blow it off as just aging.
You're doing the right things, eating better, moving, trying supplements, and you still feel a little off. It's not your fault, and it's not just aging. I'm Dr. Jake Schmutz, a naturopathic medical doctor and integrative physician. Theresa Marie and I created this channel for women 40 plus who want credible whole person path to better health. We walk you through the real pattern of midlife symptoms and the hidden issues traditional care often misses.
Yes, and I'm Theresa Marie. I'm here to represent you. I'll be here to ask all of the right questions and put everything into layman's terms so that we can feel confident about what it is that we're going through and what we need to do next. As a reminder, this episode is for educational purposes only and not considered medical advice.
Yeah, today we're going to talk about what low progesterone is and what it isn't. We're going to walk you through the core patterns, symptoms. We're going to talk about the possible causes of low progesterone. We're going to walk you through what labs you need to get done and treatments that you specifically need to do based on those labs, what we find. And then we're going to give you a personalized script that you could take to your doctor to talk to him about the symptoms you're experiencing and what labs you should get done.
Well, let's jump in, Dr. Jake, with the first biggest question. I know I kind of alluded to a couple when we first started this episode, but what would you say is a common pattern of symptoms that you find often in women who have low progesterone?
Yeah, so the pattern that I see with women that have low progesterone, and a big one is women that were sleeping fine, and then they started getting older, like let's say in their 40s, and they stopped sleeping well. That's a red flag for me and be like, hey, we need to absolutely check the progesterone. Also, they're talking to me that their periods are changing. They're getting a little shorter and they're getting a little spotty. They're bleeding at these random times throughout the day. And they might complain about that they're getting a little more anxious more easily or irritable, or they are starting to get headaches more. These are some of the symptoms that I see with low progesterone.
Now, for women over 40, what would you say are the most common causes of low progesterone?
So there's a lot of different causes that could be related to low progesterone. It could be related to perimenopause, that your hormones are just starting to change. It could be related to the luteal phase starting to get shorter. It could also be related to stressors that are happening in life, just living the stressful life, right? And it could also be related to a thyroid dysfunction. So if your thyroid's not working very well, that will also affect your progesterone production. And also, this is a big one that I like to take a look at, is you could be producing too much prolactin, and that will affect your progesterone production. And blood sugar dysregulations can also have a big effect on that. So what I see sometimes is women that are working out too hard and actually eating too low of a carbohydrate diet. That can affect progesterone also. And sometimes, like we're saying, the blood sugar dysregulation, they can have way too high of insulin, and that can cause an imbalance of those progesterone production also. And then last one could possibly be what's called PCOS, or have ovarian cysts, causing dysregulation of normal progesterone production.
Wow. So that's a lot of possibilities. If you're a woman listening to this and you're like, oh, I'm starting to get, I'm struggling with my sleep, I'm starting to get some spottiness in between my periods, and you might have heard, oh yeah, that's just very normal for your age and so forth. Stop right there and don't even listen to that, because what you just heard here are a number of possible causes, and every single one of them has a solution, so that we can actually get good sleep and feel good and be healthy clear into our 80s and 90s. And so I'm really excited to be able to talk with Dr. Jake about what we can do about this. So Dr. Jake, for anybody who's listening to this and going, okay, yes, a lot of these core symptoms match me. I am over 40. Okay, I don't know if any of these are the possible causes. What can they just start doing right away to lay some good foundational work on their health to support good, healthy progesterone before they jump into seeing a doctor?
Yeah, so I think about this in two layers. I like to think about it. It's like, what can you do at home and what can you do with your doctor? So, some foundational things that you can do that if you're experiencing some of these symptoms that we talked about is you want to make sure that you're eating a good, healthy diet, an anti-inflammatory diet that is low in refined sugar, not too high in saturated fats, etc. And it's actually good for your health. Maybe identify food reactions that you might have. You also want to make sure that you're getting enough sleep. Now, I know that's difficult if you have low progesterone. Maybe your sleep's not going to be very good, but you can work on actually doing the things you can to help you sleep, having a good sleep wake cycle, going to bed at the right times, having the same patterns every night to help you sleep, making sure that you're going out and getting enough sunshine, making sure you're getting plenty of water, not too much water. So the amount of water you need is half your body weight in ounces, and working on keeping your stress under control. All of us are going to have stress, but how do we deal with that stress? Are we doing some type of meditation, reading? Are you doing something you love every day? Doing things that actually decrease your stress every day so you don't have this long-term debilitating stress happening, because that will wreak havoc on your hormones if you let it.
Yes. And I think also it creates that vicious cycle with sleep too. So then it's what came first, the chicken or the egg kind of a situation. And I hope, Dr. J, because we're talking, you're mentioning here about getting a good amount of sleep. And one of the big symptoms of somebody with low progesterone is that they're struggling to sleep well. So I'm hoping that when we discuss some of the treatments that you're going to be talking about today, that you can share with us some of the things that you might offer some women to actually help their sleep issues while they're working on their progesterone or whatever issue is that they're having that's leading to the problem in the first place. So let's jump into, okay, they've got the foundational stuff that they've been working on. They come to a doctor like yourself or maybe a doctor in their area. What do you suggest? What are some labs that they should get done? What are some treatment options to help them with their problem?
Yeah, so let's talk about that second layer. What can you do at the doctor's office? So, labs that I want to get done if you're experiencing these low progesterone type symptoms that we discussed is you want to obviously get your progesterone checked, but also you want to check the other hormones, estrogen, testosterone, DHEA. You want to get your FSH, LH checked. That's checking there how your pituitary is working. Get your iron and your vitamin D checked. So, those are some foundational things that we want to get. And then there's some more specialized testing that we want to do. So maybe based on the questioning, we want to get prolactin checked. But then there's other things. I always want to take a look at the thyroid, make sure that's working appropriately. Like we talked about stress, we want to look at the cortisol and see if that's working right, if your adrenal glands are producing the cortisol like it should. So those are some other labs that I like to get checked when you're experiencing those symptoms too. And then some treatments that we can do if you are low in the progesterone and we identify that is we could take Vitex, we could do myo-inositol, we could take a compounded medication like a progesterone if you need that, and we track that through laboratory work and make sure we get you in the perfect range there. Obviously, if we identify if you're low in iron, take that. Want to make sure your vitamin D status is very good. Most of the time I check vitamin D, 95% are deficient. So we want to get on vitamin D in that situation. And then B6 is the B vitamin that actually helps you make progesterone effectively. So getting on B6 is always a good idea also.
And then what about sleep support? What are some supplements or things that you suggest to help women get back on that healthy sleep cycle that will probably help them make more progesterone, but also help deal with the symptoms if they have low progesterone in the first place?
Yeah, something that can really just help with that sleep because your progesterone is low is obviously you could take progesterone, but to help you without that is we could take like magnesium glycinate or taurate. I like that type of magnesium because it crosses the blood-brain barrier, effectively acts on the GABA receptors and really chills the brain out. So that's my favorite nutrient to take to really calm the brain down.
Now, earlier I had mentioned like yam cream. I know a few different people that I know, they're like, I think I'm starting to have low progesterone. I think I'm just going to hop on Amazon and like go pick up some yam cream.
Yeah.
What are your
Uh-huh.
thoughts on that?
Yeah, so yeah, yam cream could possibly have progesterone, but if you're getting it from like a place like Amazon, you don't know how old it is. They don't really put the date on there. I like to use supplements within a 6 month period of their manufacturing date to really make sure they're potent and good. Amazon, you're not going to know that. You could get something that's 2 years old and the potency's greatly decreased. Also, you don't know if the progesterone milligram dosing is perfect. So I don't usually recommend yam creams because I'm not going to know how specific it's going to be. Are you getting the same dose every time? So I like to get it from a progesterone from a compounding pharmacy where it's able to be perfectly dosed. I'm able to track it. So every 2 months, I'm checking the blood work, looking at your progesterone to make sure we get the perfect dose for you. That's really hard with the yam cream because you just don't know if you're getting the right same milligram dose every day.
That makes a lot of sense. I know for me, I started off on a really low amount of progesterone, got my body kind of used to it. adjusted to some of those changes, and then went back and got some more testing done to see how my levels were at. And it seems like I actually needed a little bit more. So being able to work with a doctor like yourself, you're able to control more of the dosing. And so I could have a higher dose of progesterone and be able to literally see the benefits, literally be able to see how it's actually interacting with my blood. I feel like yam cream it could help. How much? We don't know. How long? We don't know. It feels like it's more of like throwing spaghetti against the wall and hoping it sticks type of solution. When if you really are dealing with some of these symptoms and you really want to get a solution that works and that you can sustain, it seems like it makes much more sense to get the blood work done and get some of the supplements that you recommend here, or even getting on some HRT to help, depending on what that possible issue is. So for those of you guys who are listening, obviously Dr. Jake shared foundational things that we could be doing at home to help with that. I know that a lot of us that are watching this are already really trying to take care of ourselves. That's why we watch videos like this. We are very concerned about our health. We're trying to do things to take care of ourselves. And so, but making sure that we're not over focused on one and not doing the other. I think that you made a really good point, Dr. Jake, about some women that are over exercising or eating too low carb of diets. That sounds great. And it seems healthy to go keto or do some of these more trendy diets that are supposed to be really good for our health. But for women over 40, we actually really do need carbs, and we really do need protein in order to be able to help our bodies. And making sure that we're doing a diet that actually really fits where we're at in our stage of life, I think is going to be really helpful in helping us make everything that we need and feel really good. So Dr. Jake, at this point, if someone were to, okay, I'm doing the right things, I'm at home, I'm making sure that I'm, taking my supplements to sleep better, I'm managing my stress, I'm doing this, I'm doing that, I'm an anti-inflammatory diet, they're ready to go to a doctor, maybe a doctor in their area, maybe you, what would you recommend that they say so that they don't get blown off?
Yeah, so let's give you a script that you can use when you go to a doctor. These are some of the things I like to hear when a patient comes into me of what they're looking for. So here's just an example type of script. For example, it's like, okay, I'm a 46-year-old woman, and for the last blank number of days, I've noticed these specific symptoms. I'm concerned this could be related to progesterone, and I'd like to work with you to rule out low progesterone. Here's some of the labs that I would like to get done. I would like to get my progesterone, DHEA, testosterone, FSH, LH, prolactin checked. I would also think it would be a great idea to get some other labs like my detailed thyroid panel and cortisol checked. And if this is something that you don't feel comfortable with or what you're not willing to order, do you have a referral for me?
Dr. Jake, I just love that last part because it really does help you as the patient be able to tell the doctor, I'm really serious about this. And if you're going to blow me off, that's fine, but I will see another doctor. So I'm going to be nice and I'm going to ask for a referral. Either you're going to help me or I will see somebody else. And I think it's set up in a nice way. It's set up respectfully. And I think a lot of doctors, when they feel respected, but they also see that you're very concerned about this and that you know what you're talking about, that they're more likely to comply. But if your doctor blows you off still or says that they don't feel comfortable with it, they don't have a referral, or you just want to skip that process because you already know your doctor and you know the type of person that they are, and you want to just see somebody like Dr. Jake, who already knows very much about low progesterone and how to treat it, we have a link that we can put down in the show notes and in the description box below, so you can click on that link to be able to schedule that free 15-minute call. But it is drjakewellness.com/schedule. Dr. Jake also did mention a couple of supplements that could be very helpful for somebody with low progesterone to help you with your sleep, or even things like Vitex, chasteberry, and things like that can help just support your progesterone levels, vitamin B6 and so forth. He has a high quality supplement line. And as he mentioned, like, he really cares about the age of the supplements. He doesn't want to be selling stuff that's over 6 months old. He really looks at what the ingredients are and so forth. So he has supplements that you can really trust. And we have a link down below as well where you can visit his supplement line at shop.integrativemedica.com. And if you use the coupon code or the promo code Dr. Jake, you'll get 15% off any of those supplements. Dr. Jake?
Yeah, if you want to learn more about hormones and you're watching YouTube, click my video to the right. I'm Dr. Jake, and I'll see you there.